Hello, I'm very pleased to welcome today Hemali and Rikki, two veterans in the area of health communication, to the PRmoment India Leadership Podcast Series. Actually, podcast is the wrong word, video podcast series for the year 2021. We are when you talk about ADE and BC, it's almost like post-COVID 2021. It's almost become like a marker. So my first question for both of you is that how is the super trend of COVID, how will that influence health communication in a general way? Any of you can take the question first. Um, Vicky, would you like to go first?
Yeah, of course, of course. So certainly the pandemic has fueled a growth in the health com sector. It's fair to say that our jobs have never been more important than they are at the moment. But I think that growth that we've experienced also balances with the experience we had in 2020 during those very early and acute phases of the pandemic's arrival. At that point in time, our industry slowed just as much as any others. It was for a period almost inappropriate to be communicating too loudly on other healthcare topics that potentially distracted the public from what they needed to know and what was emerging in regards to COVID-19. Now, we've had some time to get used to living with the pandemic, obviously, and the healthcare industry as a whole, as a result, has found ways to be appropriately communicating across all needed healthcare topics, while at the same time, certainly the vaccine rollouts this year in particular have seen a rise for our services. But that rise will ultimately decline, and obviously that will be nothing but a good thing for the world at large.
Thank you, Ricky. Over to you, Himali, for the same question.
Absolutely. I completely agree with Rikki what she said. The COVID-19 actually brought with it an epic challenge for us as healthcare communicators. The sheer magnitude has widened the scope of work from not just managing communication, but to steering advocacy, and that we all saw experienced in real life when the entire vaccine rollout has happened across the country. So, unambiguous, evidence-based, targeted messaging combined with persuasive mobilization of people and resources has proved to be the need of the hour. And that, as healthcare communicators, we will definitely want to advocate. And reiterating the fact that, the need to provide the clear, honest, and valid information to the public, not just in India, but across the world, has become even more important. And we take it on ourselves as a responsibility to communicate the same. So, it was not just a pandemic of sorts, COVID-19, but we've seen through the last year that it became a disease of panic with so much of information around. So, it's very, very relevant and required at the current moment to provide the public at large with verified information.
Thank you. For those of us who are still, for those of you still joining in, I'd like to formally introduce Hemali and Rikki. Hemali Bhutani Mahajan is the Managing Director of GCI Health India. Welcome, Hemali, formally welcome to this recording. And Rikki Jones is, of course, President APAC for GCI Health. Welcome, Rikki.
Thank you very much. Thank you for having us.
To carry on with the conversation, I think Hemali, what you said about evidence-based communication is key. I'd like to take the conversation to the direction of digital. What you talked about is also a potential of digital, and also the negative effect of digital is what we are looking at. So, given that kind of situation, what is the strong push that the COVID has given to digital communication? What are the implications for medical record safety of data as well as patient empowerment? So, Rikki, would you like to take that first?
Yeah, of course. And I think it's a really exciting time for digital health and medtech at large. We've seen such fantastic acceleration of the possibilities as a direct result of the pandemic. And I think one of the really exciting opportunities and challenges that our industry now has is how do we keep up that same rate of innovation as the pandemic ultimately starts to slow? And one of the big realizations to come out of the pandemic, or at least in accelerated form, is the real recognition of potential when it comes to self-care and how self-care can be better fueled by medtech and digital health innovation. So the role that we can be playing as consumers and as patients in our own home settings, from both a screening and a treatment point of view, that might bring down an over-reliance on very overburdened healthcare systems, not only now during the pandemic, but also on an ongoing basis. Now, you raised some of the negatives that surround that in your question, and that's a very valid point raised. Certainly, data privacy and patient privacy is a huge consideration in what this acceleration looks like. And we have to be guardians of that within our industry, and as the potentials evolve, making sure that patient privacy really sits at the center of what the future looks like.
Thank you. I'll come back to you, Rikki, for a related question on privacy of data. Hemali, given the fact that India patient empowerment, decreases as caste, religion, and poverty filters are put on, it really literally plummets. So, given those kind of and given the lack of access to digital options, how do you see the impact of digital, and how would you handle these new challenges for communication, which COVID has really sort of made very urgent?
So definitely, Parul, as a country, we are very diverse. There is inequality when it comes to use of digital. There is access issues. However, as a country, we are moving towards opening up and accepting that these are the gaps that need to be addressed. And yes, it happened at the time of pandemic, but we always need a trigger or a reason to find that, probably this is a gap that we need to address. And COVID-19 has provided that with us when we, obviously, as a country who has rolled out the largest vaccination program. Given that, I think the intent is right. People are opening up and accepting digital. Traditionally, the healthcare industry has been slow to change as it needs to cater for high level of regulation, increased use of technology for health purposes during the pandemic, especially by patients, may drive like lasting change in much the way that people, once probably rejected the entire mobile banking technology. But now people have opened up. There is acceptance.
What does that mean for communication? Because a lot of the health communication, especially targeted at certain sections of society, had to be offline, had to be with peer group, specialty groups. So that is becoming extremely difficult in this. And the fact that a lot of them will not have access to mobile phones. For example, in a family, it's not the woman who may not have the mobile phone. It would be her son and her husband, most likely. So how can communication address some of these issues? Of course, no one communication can address the deep-seated issues. But what is the trend when offline is missing? That's what I wanted to find out.
Parul, actually, it's very interesting that, as a fact, if we see it from the other side of the lens, the fact that at least one person in the family is open to or is aware of technology, or like you mentioned, the mobile technology. I need not have all members of the family aware of it or using it as a technology. It isn't possible. It isn't possible in the urban setting. So to expect it from a rural setting will be difficult. But I think we should look at from the lens of the fact that, at least one person in the family uses technology and can further educate the other members of the family.
Okay, we'll come back to that more when we talk about the experience of booking vaccines online and the problems and challenges that created. We'll come back to that. Coming back to Rikki about the question about medical data internationally, and this issue is not really caught on in India that much, but the disclosure of your COVID status. I just wanted to get your views on the communication of that. I know that a lot of companies did a lot of active communication about encouraging vaccination, and also making it operationally easy for them. The communication was around the operational, making what are the operational benefits. You get a bus or whatever, or they arrange for a camp. But hasn't disclosing your COVID status become a very important aspect of internal communication for companies? The pros and
Yeah,
cons of that?
absolutely, it has, and it's really interesting watching the issue and the debate around exactly this play out in different countries. You have markets like Singapore, where there's very high trust in governments, and in those types of settings, there is absolutely a correlation between a trust in government and a willingness to move forward into these digital options, where COVID status and certain elements of personal privacy and health are ultimately shared. In countries where that trust in the government goes down, that willingness also goes down as well. And we have to be able to find ways internationally. Obviously, COVID-19 is not a domestic issue in any nation. None of us are safe until all of us are safe. So unless we find ways in which that we can work with one another across borders, to have the faith that we're not going to be putting individual countries at risk when borders open, we're going to be stuck for a long time to come. So the debate is certainly warranted, and we have to be able to explore options that are going to be suitable and beneficial for all governments and all citizens. And that's not an easy task.
But what does it mean for a corporate? Like, do you disclose in an office, for example? Are you supposed to disclose in a corporate setting?
Yeah, I think lots of individual countries are still, for the most part, companies are for the most part still taking government guidance on what they should and shouldn't be doing in that regard. And look, there is an element of and an opportunity here, I think, for some large corporations to start to really take a stand and be encouraging vaccination by mandating certain health checks, certain disclosures. That comes with it, of course, a whole raft of questions around privacy and what is the role of an individual corporation versus the role of a government for its citizens. And I don't think we have yet arrived at a place where there is a very clear answer on what those delineation of roles should look like. That will need to evolve, and it will need to evolve in the context of how well our governments worldwide are doing that role on our behalf, not only within countries, but also working collaboratively across borders.
Thanks. Actually, that's a really interesting dimension to it, that it has to be trust in the government, which would probably direct how even companies behave. Flowing from that and coming back to the medtech question, first for you, Rikki, and then to you, Hemali, what areas within medtech do you see emerging as potential profit centers, the wrong word, but potential growth areas for health communication? We have the whole range from online consultation to surgical medtech. There's a whole range of medtech. What areas do you see emerging as focus areas for communicators?
Great question. And you're right in that there's been a whole range of areas across the medtech spectrum that have evolved really rapidly over the last 18 months, 2 years, for all of the obvious reasons. I think the areas, really taking off, going back to one of my earlier mentions, are innovations that support better self-care in all markets, in developed markets, in which we're giving more power to the patient and to the consumer, and into markets as well where healthcare systems are potentially not as sophisticated, and looking at self-care options as an opportunity to reduce burden on healthcare systems. And I think with any new innovation when it comes to health at large, but medtech certainly, and the digital space, it requires a huge push from the very beginning and ongoing from a comms perspective. Anything new, people need time to get used to. They need time to trust something that has worked differently to the way that they have approached their health before. And as we all know, and particularly for different generations, there's an inertia. And some people and some generations really like, for example, the interaction that they might have with a healthcare professional. And we might be able to evolve options for that to not be as big a need, but there comes human behavior, and behavior change takes time, and we have to be able to take on board people's individual preferences, their needs, their cultural anchor points, and the experiences they've had to date in doing so.
Thanks, Rikki. Hemali, putting on your India filter, what areas do you see emerging? And I know like online consultation has exploded literally. So apart from
Absolutely.
that, what else?
Yes, Parul, as a country, we are very cultural, very traditional. So visiting a doctor and getting a personal connect with the doctor and a personal consultation is something that, satisfies us as patients and consumers, that, probably we've been advised the best. Now, when the filter of technology comes between the doctor and the patient, uh, it really becomes difficult. And it's not that telemedicine has not been in the country, it has been for a long time. It's only since last year that people have understood the need and importance of doing a teleconsultation with a doctor in order to further safeguard them when we are locked down in our houses and not able to go out, probably even step out from the door of our homes. So I think as the acceptance of technology during the pandemic has seen a surge in the country.
That's actually like a mega trend which is guiding everything. Coming to the point of vaccine hesitancy, one of the biggest issues in India was not just lack of awareness, but also the fact that the app for booking was in English, which was a major barrier for people. And of course, we set up a lot of free camps where people would register for you, but still, it really took away the independence of opting for it yourself. So Himali, first you and then Rikki, I'd just like to get your views on vaccine hesitancy, which is going. Vaccines are always controversial. You have anti-vaxxers and the rest of it. But what are the new challenges within this? It's the first time that a vaccine has been developed so fast, probably in the last 100, 150, 100 years. And it's still testing. It's going to be an evolving vaccine. So, given all these things, I'd like your views on the communication challenges, and then Rikki, your views as well on the same topic.
Parul, yes, did see some hesitancy, and that's when we took it on ourselves as healthcare communicators, as a responsibility for ourselves to communicate to the masses what's actually right. It's not just vaccine hesitancy, Parul. I would want to direct your attention to the fact that, there were a lot of myths that were surrounding the entire vaccine rollout. So, and that was actually the cause of increase in vaccine hesitancy. So, as a as a responsible healthcare communicator, it was our responsibility to communicate in whatever capacity that we could to educate the masses that you need to refer to facts. And as I had previously mentioned that this pandemic, while it was a healthcare pandemic, it was also a pandemic for misinformation and disinformation. So healthcare communication became even more relevant during this time to address that.
So, can you relate any specific anecdote or incident that you experienced during health communication, which you remember where misinformation was countered or yeah.
Absolutely, actually, a lot of it, Parul, because as an organization, we were given the task to help the government of India to roll out the entire vaccine program, and it wasn't about doing integrated marketing communication around it, because that was more uh, the government role, and they were driving it completely. But our role was more in terms of um, training the spokesperson on what is the right kind of messaging that needs to go out. If and the job that was entrusted in us was to identify what is the wrong information being quoted in media and connect back with the medical team, which was working on this entire vaccine rollout, get the facts in place, and then package it well to be able to support the spokesperson to communicate it further to the media. So I think because of that entire exercise that we did with the government of India, I think that really helped us a lot in identifying the real reason behind vaccine hesitancy.
And what was the real reason behind
I
it?
told you, it's misinformation, it's disinformation. It's about, people not knowing the right facts, and then they assume that probably this is the way to go about it, or probably just relying on sources which were not verified.
I think as part of that.
Yeah, sorry. Go ahead, Rikki.
Thanks. Just to add to that, I think part of the misinformation piece is a real lack of understanding around the risk and benefit profile of the vaccines, which also highlights a lack of understanding around the risk and benefit profile of any medication or vaccine that we choose to consume in our lifetimes. There is no medicine or vaccine on this earth that is completely risk-free, but that is easy to forget when certain medications or certain vaccines are so part of our everyday life, and we have to be able to educate the public at large on the benefits versus the risks and be very clear on those risks, so people can make those factual, informed decisions in the context of their own values and preferences and cultural anchor points again, that is going to allow themselves to decide for them and their families. And we
You're so right about that, and I'll quickly share my own personal experience because I was organizing for my domestic staff, and they were very clear on 2 points. Firstly, we want the same Covishield vaccine that you got. That was very important, and we don't want the free version. We want the paid version. So I'm like, no problem. But I remember being fairly terrified that if they have an adverse reaction, they're going to blame me for that. But I was impressed with the clarity they had. That not the free one because they don't trust the free one, and the same. They knew the name as well. That we want the Covishield one. So you're right. It's people are assessing it, and if somebody else has taken it, that actually acts as a spur, and they've been all right. So that really acts like a spur. Coming to we are concluding the recording right now, interview. The last set of questions for you. Health communication has, in a way, not been a very hot priority for at least in India. And I know as a journalist, it was always, unfortunately, 20 years back, women who were given the soft beat of health to cover. And I remember covering tuberculosis and HIV, and my editor telling me all numbers are big in India and diseases. So what's the big deal? Where's the story? So given that kind of background to health communication, do you think health communication has finally arrived, and what do you think will be the impact on an agency's bottom line in terms of the contribution it will start to make? Rikki first, and then
certainly. Sure, and certainly I think there's a moment of arrival for health communications, and where seeing the critical importance of getting it right or wrong, it's making or breaking health minister careers the world over. In terms of whether that's going to have a difference for the bottom line of health communications moving forwards, I think that's a real big question mark, to be fair. Certainly, yes, it might have a bottom line impact for the immediate years in front of us, given the increase that the pandemic delivers us in terms of the requirement of our expertise. But health communications has always been there. The need has always been there. We've always been there. And I think it remains to be seen in terms of whether we will experience a long-term increased value recognition as a result of the pandemic. But that's indeed an opportunity that stands in front of us. And I think it's an opportunity for us to seize.
Thank you, Rikki. Hemali, what do you feel? Absolutely. I actually agree with Rikki, and my view again is that, healthcare communication has always been relevant in the country. It really helps you drive behavior change and showcase impact. Like you mentioned, Parul, yes, any number in India is big, but I want to draw your attention to the fact that, uh, these numbers actually total up to the fact that, we actually become the top one or almost the top three countries in the world facing any big disease or disorder. So, like, we are becoming the diabetes capital of the world, right? So, I think due attention needs to be given, and with the right attitude to address healthcare communication. And I would also would like to tell you that, it wasn't that healthcare communication was not being done in the country. Yes, but in the last 1 year, there are more and more people taking it seriously. Hence, there is a rise of acceptance to healthcare communication. Even brands who used to resort to advertising or other means of communication are now looking at integrated marketing communication as a whole bouquet to present or to reach out to their stakeholders and patients. So, yes, definitely a surge has come in, but healthcare communication has always been relevant, very relevant.
We'll just conclude the interview then. It's been a very interesting interview, and really learned so much about what is new in health communication. It's been wonderful speaking to you, Hemali and Rikki. Thank you for joining us on the PR Moment India Leadership Series. And here's hoping to better health and safe health for all of us. Thank you.
Thank you so much,
Indeed.
Parul.
Thank you for having us.